Hey, let's talk about normal newborn care, something that all of us experience when we have a baby, obviously. First, let's talk about feeding. Normal feeding is every 2 to 3 hours. That's the normal time range that we're looking at. We really don't want to go less than two because then they snack all the time rather than get full. But we don't really want them to go longer than 4 hours either. So, somewhere between 2 and 4 is the normal thing. If they go longer than 4 at night, that is perfectly fine. If they go up to 4 during the day, I would wake them up and feed them at that point. Don't wake them to feed them unless it's been longer than 4 hours during the day. And that's important during the day. During the night, let them go as long as they can. But during the day, we don't want them to go longer than 4 hours because then they will be up during the night to eat. Feed them until they're content is the answer to how much do we feed them. For some babies, that's 2 or 3 ounces. The normal amount is about an ounce per hour of the day. So if it's been 2 hours, they usually eat 2 ounces. 3 hours would be 3 ounces. But some babies eat less than that, and other babies eat more than that. It really just depends on the baby. As long as they're pooping and peeing and growing, we're actually just perfectly fine. Let them go longer at night. We want them to go longer at night. We want to get sleep sooner rather than later. The age-old question of formula versus breast. Breast is obviously best. It's the way God made us. It's the way things are supposed to be. But I will say that in my 35 years of doing this job, I can't really tell the difference between a breastfed baby and a bottle-fed baby. Breast is best for immunity, for bonding, for infection risk, all of that stuff. But I can't tell the difference between a breastfed baby and a bottle-fed baby as far as growing, as far as number of infections, as far as IQ, as far as ACT scores, all of that kind of stuff is really the same as far as the data shows. So formula is a perfectly fine alternative to breast milk. Okay, let's move to rashes. Babies are really rashy. Newborns are really rashy. They've been in a liquid environment for 9 months, and when they come out, their skin is just not ready for prime time. So when they come out in the dry air, heat, etc., fabrics, it's very frequent for them to get rashy. Very rarely are they of significance. They're very rarely serious. So usually it's just related to dry skin and bathing. So let's talk about bathing. Most people bathe their babies every day just out of a normal cultural habit in America, but it doesn't have to happen every day. You can bathe them every 2 or 3 or 4 days, uh, as long as they're getting clean each time you do it. You don't really need to use soap, just water is perfectly fine. Um, Moisturizers is something we get asked about a lot because babies do get dry skin. The better answer for dry skin is bathe them less often and don't use soap. But if you do that, if you bathe them less often and you're not using soap and the skin is still dry, a moisturizer is fine, but just make sure that it is warmed up on your hands and that you're applying it in a warm room. Babies get cold really easily because the surface area is so much bigger than a grown up, so they can get cold really easily. So we don't want that to happen. So make sure the room is really warm. How about the feeling that I don't know what I am doing? Every parent can relate to this, and the reason is because you can join the club. We all feel that way. I felt that way when I first had our first baby, and everybody feels that way. I don't care how much education you have, until it's your own baby, you don't know what you're doing. So just be okay with that. That is a normal feeling. Keep it simple. This is so hard on modern parents. They want to get all of the gadgets and they want to get all the data. They want the oximeters, the monitors that keep up with everything, the apps that keep up with pooping and peeing and all of that kind of stuff. All of that is just not necessary. Just tend to the necessities and things will go a whole lot better. Make sure your baby's fed, warm, clothed, clean, and everything will be a whole lot easier. Let's talk a little bit more about sleep. Babies sleep a lot. Basically, the first 6 weeks or so, if they're not eating, they're usually asleep. So a lot of babies sleep 22, 23 hours a day, it seems like. And that's okay. Leave them alone. Let them rest and grow. Hold them obviously as much as you want to, but don't feel like you have to hold them the whole time because sleep is a vital time when they're growing rapidly. Next up is diaper issues. Diapers are something that is foreign, so babies frequently have diaper rashes related to lots of poop and pee and lots of diaper changes. So just be ready for that. Skin breakdown and rashes is a very common uh, problem because the body's just not used to having that kind of irritating substances on it. So use a lot of Desitin or A&D or Boudreaux or any other kind of barrier ointment is fine, and things will go a whole lot better for you and prevent those diaper rashes and frequent diaper changes. Back to the non-essentials. Stay off of social media. Social media will convince you that there's no possible way that you can manage this rocket launch of getting a child up and going for the first couple of months. And it's just not true. It's just not that complicated. Social media will give you all kinds of things to worry about that are just not necessary. So try to relax, try to enjoy it. And just as long as you keep them fed and warm and stay off all the gadgets that Amazon sells, it's going to go perfectly fine. Euro formulas is another thing that we hear a lot about. European formulas are no better than American formulas. Mothers are convinced that the latest, greatest thing from Europe is always the best, and it's just not. There's just no indication for that. So don't fall for the social media or the marketing campaign online. It's just not true. It doesn't help. Let's talk about your baby's growth. Usually, a baby gains about an ounce per day, but they do lose weight for the first week and then gain it back the second week. And so by the 2 week checkup, they're usually back to their birth weight. Then they start gaining about an ounce per day. Some babies gain a little bit less, some babies gain a little bit more, but overall, it averages out to about an ounce per day. Uh, do not weigh your child at home unless there's some pressing reason to, as in a heart problem or something, some significant health problem that makes you have to manage their fluids. Because if the baby is pooped or peed or just taken a bottle, their numbers can vary by 6 ounces from the morning till the afternoon. So don't get hung up on weighing your baby at home, and certainly don't keep up with graphing your child's growth or anything like that. Congestion is a super common complaint. In fact, I would say it's essentially universal. It's a normal thing, so don't let that worry you. Babies just oh, have to get all that amniotic fluid out of their lungs and out of their nose and out of all the crevices of all the sinus passageways and stuff. So just give that time. That will get better. If you wanted to run a cool mist humidifier, that would be fine, but that's not even necessary. So really don't worry about the congestion. That's just normal. As long as they're able to breathe through their nose comfortably, you're fine. What about spitting up? Spitting up is a super common, almost universal thing as well. Every seasoned mom has or dad has spit up on their shoulders on both sides from burping their baby. That's just a normal thing, unless it's severe, profuse, painful. The baby's not growing. Um, it really is just a normal thing. So hang in there with that and just kind of, as long as the baby's not in any kind of pain and is growing okay, you're perfectly fine. What about going out in public? This is a super common question, and it depends on your tolerance level. If it's your fourth child, you're going to be out in public a whole lot more than you are with your first child. Most people with their first child stay at home until the baby's about 6 or 8 weeks. Generally, they wait until the baby gets their first vaccines, but that really is just a line in the sand because the vaccines really don't prevent anything that you're going to catch. You're not going to catch polio out of the grocery store or something like that. So it's really kind of an artificial line in the sand. But the baby's certainly fine to go outside. And if the weather's nice, get outside, get fresh air, go for a ride, do something to get your mental health better. And then if you have older children, some people go to the baseball field when the baby's 2 weeks old. That's perfectly fine. There's no rules about that. There's nothing dirty about the air at the baseball field or soccer field or wherever. So do what you need to do. And just getting around other children, other sick children, is the only real risk factor. What about the grocery store, restaurants? That's a judgment call. If you have older kids, you're probably going to be doing some of that stuff. If you got the first time baby, yeah, probably not. Uh, that's really totally up to you. It's not the main problem is being around running those little kids. All right, just remember you're in survival mode. New babies put you in survival mode, and that's perfectly fine. That's where you need to be. You need to get rest and rest up yourself when your baby's sleeping. You need to give your body time to recover. You need to feed the baby when they're hungry and don't worry about the baby otherwise. You need to keep the baby warm and dry. You need to snuggle with the baby as much as possible. And you need to give it about 6 weeks, and everything is going to be okay. So hang in there, be tough, try to get some rest. Survival mode will pass eventually. If you like what I'm putting out, please like, follow, and subscribe, and look forward to next time.